Good morning, APOSI peeps! Welcome back to our Wednesday Wellness webinar. So today, our topic would be upper respiratory tract infection. It's because nowadays it's rainy season and it's December, so medyo malamig yung panahon. So we want to explain to you the reasons why most of the people are experiencing upper tract respiratory tract infection. With that, we invited a speaker or in-house speaker. She's a colleague and one of our nurses. So let's welcome Mary Claudine Casabuena, RN. Hi, Nurse Claude.
Good morning. Thank you, Nurse Edlin. Good morning, everyone. I'm Mary Casabuena, your speaker for today. And our topic is all about, for this Wednesday Wellness, is upper respiratory tract infection. For today's discussion, we will define what is upper respiratory tract, what are its causes, symptoms, risk factors, treatment, complications, home remedies, and prevention. So what is upper respiratory tract infection all about? It is an infection of the upper respiratory tract. So what includes upper respiratory tract? This includes the nose, the throat, the pharynx, the larynx, sinuses, and the trachea, or what we call the windpipe. Safety isn't expensive, it's priceless, so we need to take care of ourselves and others as well. The vast majority of the upper respiratory infections are caused by viruses. So what are these viruses? It is defined as microscopic infectious agent, prolific or very plentiful and found in almost life forms. It can only replicate inside the living cell organisms. Viruses infect host cells to reproduce. What are its means of transportation of the virus? So it can spread from person to person through coughing or sneezing. So that's why if we cough, usually we use our hands. Then after that, minsan nakakalimutan natin to wash or put alcohol sa kamay natin. Unconsciously, nakaka-touch tayo ng any surfaces. So doon pa lang, pag nahawakan siya ng ibang tao, nagsa-start na ang spread doon. Pwede naman tayo, if we sneeze, we have to use our clothes like this and put inside. So doon tayo pwedeng mag-cough or sneeze. So at least, mas safe siya na hindi tayo nakaka-spread ng virus. Next is viruses can learn to adopt immune responses. It also are much more difficult to treat than bacteria because sa bacteria kasi, there is what we call medicines which is antibiotic. So 7 days ang treatment nun. Unlike sa viruses, wala pang gamot for the virus. Although now, they are starting already to produce medicine for the COVID infected people. So what are the causes? Both virus and bacteria, it causes the upper respiratory tract infection. So they are the main culprit kung bakit nagkakasakit yung tao. Then the immune system of the young and adults and children are often very vulnerable because they have very low immune system. Then other cause is the upper respiratory infection is also contagious and airborne in nature. As what I've said kanina, na nata-transfer siya through what we called droplets. And naaano din siya sa air, kaya madali, pag na-inhale siya ng isang tao, especially pag ang immune system is mababa, so madali siyang kakapitan ng sakit. And then, other cause is not washing the hands before meals. Not just before meals, but also, minsan sa isang araw, nag-alcohol lang tayo ng alcohol, so hindi tayo naghuhugas ng kamay, which is not proper then. So as much as possible, we need to keep our hands clean all the time for not to spread the virus. Another cause is if you have any lung problem or heart disease, these are people who are who have low immune system kasi they undergo medications. Also, those who have inflamed tonsils, kung yung tonsils mo is already mapula na, and then plus uminom ka pa ng malamig, which triggers to the condition. And of course, masarap naman talaga yung ice cream and milkshakes, especially. So, ang nangyayari is nag-worsen yung problem. So, that's why that's the start of tonsillitis, or later i-explain natin how it looks like and what are the prevention and the treatments. Of course, exposure to some flu or cold can cause pharyngitis. It can also be caused by a secondhand smoking. So unconsciously minsan, may kasama tayo sa work na may flu pala siya, tapos nag-sneeze siya, unconsciously, hindi niya na-cover yung mouth niya. So through air, nag-spread na siya, na-inhale ng iba, so nagkaroon na sila ng sakit. Then the birth defects or structural defects in nasal cavity, example nito is yung may mga cleft lip, yung dito may mga hiwa. So very susceptible sila na makapitan agad ng sakit. And then those nasal polyps that can cause sinusitis, especially pag yung may mga sinusitis na yung polyps nila sa loob, yung mga bilog-bilog yan siya nasa loob ng nose nila. Pag nag-inflame yun at naka-inhale pa sila ng mga viruses or bacteria, so very susceptible sila na magkakaroon sila ng sakit. Okay, what are the symptoms? Of course, we have cough, sneezing. Sneezing also is for mga allergic rhinitis. They are very common sa kanila yung sneezing. Then runny nose, nasal discharges, fever, nasal congestion, sore throat, and nasal breathing. Pero these symptoms vary from person to person. Hindi ito lahat-lahat na i-experience ng isang tao. Minsan, makaka-experience na ng cough, may sneezing, may fever. Yung iba naman is only nasal discharges, may runny nose, and sore throat. So, nag-iiba-iba sila, pero hindi ito lahat na i-experience ng isang patient. What are the risk factors of upper respiratory tract infection? First, physical or close contact with someone with an upper respiratory infection. So very susceptible tayo, especially yung mga gathering. So pag may close contact tayo sa isang taong may upper respiratory tract infection and ang immune system natin is mababa, madali tayong kapitan ng sakit. Okay lang kung ang immune system natin is malakas, so hindi tayo agad-agad nagkakasakit. That's why we need to boost on our immune system. How can we do it? Yung the last time na topic natin is we have to eat fruits and vegetables and of course vitamins every day. So the second one is poor hand washing after contact with an individual with upper respiratory infection. Minsan kasi busy na tayo or may kailangan tayong tapusin na work, so agad-agad diretso tayo sa work without washing our hands. So if ever may mga contact tayo or may natatouch tayo na any surfaces, after, kailangan natin maghugas ng kamay, not just alcohol lang. Of course, close contact with children in a group settings, school or daycare centers. So yung mga bata, as what I've mentioned kanina, because they have low immune system, that's why madali silang kapitan ng sakit. Contact with groups of individuals in a closed setting such as traveling, tours, and cruises. If you notice kasi pag nagta-travel tayo, minsan kulang tayo sa tulog or most of the time, nasa labas tayo. So, if mga ganitong times, we need also to take vitamins kasi bumababa yung immune system natin. And usually, during the travel, doon tayo nakakakuha ng mga iba-ibang sakit. Mostly, doon is the upper respiratory tract infection. Of course, smoking or the secondhand smoking. The healthcare facilities, for example, like the hospitals and the clinics, kasi doon talaga pumupunta yung mga taong may sakit. So, tendency is madali tayo makakakuha doon ng iba't ibang sakit. Then, immunocompromised. So, who are these immunocompromised people? They are people who have very low immune system. It can be temporary or permanent. So, who are these? Those people who have AIDS, or HIV, those people who have cancer, mga transplant patients, and those who have inherited diseases like congenital disease. And of course, anatomical abnormalities as in facial trauma, for example, nagkaroon na sugat yung mukha nyo, upper airway trauma, and nasal polyps. We will discuss now the 5 upper respiratory tract infections. First one is the common cold. It is an infection that affects the entire upper respiratory system. So, ano yung mga symptoms ng common cold? First, we have clogged nose. Of course, sneezing. Nagkakaroon rin tayo ng sore throat, dripping mucus from your nose, stuffy feeling, yung feeling mo talaga very uncomfortable, and fatigue. So this picture shows ito yung runny nose na nagkakaroon ng mga mucus secretion sa loob. And of course, yung loob ng nose natin is swollen, namamaga siya. Later, we will discuss kung bakit nagkakaroon dito ng post-nasal drip na tinatawag at paano yung nakaka-affect din. And then, sore throat, which we'll later discuss. So the common cold, ito na yung symptoms niya. Then we're going to the treatment. Yung mga treatment options na to, this is usually the treatment options that we have at home. Pero pag 2 to 3 days na hindi pa nawawala yung sakit niyo, you need to consult a doctor. So first, we have to have lots of rest. Because through rest, nakaka-regain tayo ng strength. And through that, nakaka-boost din siya ng ating immune system. So, minsan kasi ang kulang sa tulog, kaya bumababa yung immune system natin, kaya madali tayo kakapitan din ng sakit. Extra fluids for hydration, the congestants or nasal sprays, these are the medication to relieve symptoms. But then, sa mga nasal sprays, kailangan natin ng prescription ng doctor. Of course, healthy diet. We need to eat more fruits and vegetables for our immune system. Then, hot soup or drinks, mas maganda siya if may sakit tayo kasi yun lang yung matotolerate natin minsan na kainin din. The use of antibiotics. That's why we recommend talaga that patients will check sa doctor kasi the doctor will be the one to distinguish whether yung sakit mo is viral or bacterial. If bacterial kasi ang sakit ng isang tao, the doctor will recommend antibiotics, which is usually 7 days. So, kung nag-self-medicate ka lang at nagpareseta ka lang, for example, may kilala ka, nagpareseta ka lang ng antibiotic, which is not supposed to be kasi viral infections cannot be treated by bacterial medications. So, still, doctor-based pa rin tayo. So, the second one is the pharyngitis or commonly what we call the sore throat. Sorry. First picture showed na this is the picture of a healthy throat. So, wala talaga siyang problem. The next picture showed is streptococcal pharyngitis or this is usually caused by bacterial infection. Kaya nagkakaroon tayo ng mga pus sa loob. Ito yung tinatawag natin na mga pus, yung mga puti sa loob. So this can be treated by antibiotics. Yung third picture naman natin, it showed inflamed throat. So ito, affected ito siya ng viral infection. So makikita natin yung distress. So that's why yung antibiotic, very much important na kailangan pa rin natin mag-seek ng advice ng doctor because kagaya na sa picture, madidistinguish nila kung ano yung tamang medication para sa inyo. So what are the symptoms of pharyngitis? So of course, we have the throat irritation which will start talaga siya kapag irritate yung throat mo. After ng irritation, nagkakaroon tayo ng redness or inflammation, kaya nagiging inflamed, kaya minsan masakit na siyang lumunok kasi yung throat natin is already inflamed. Of course, nakakaranas tayo ng fatigue and general feeling of being unwell, not really feeling well. Ang ang pakiramdam, mabigat, parang walang ganang pumasok sa work or walang ganang pumasok sa school. Then, of course, pain during swallowing. Kasi nakita naman natin na yung throat natin is already magkakaroon siya ng mga nana sa loob. So what are the treatment for this? The treatment options are, you have to drink more fluids for hydration. Of course, painkillers such as ibuprofen or paracetamol para dun sa pain. Pwede naman tayo makapurchase dito ng over-the-counter. But of course, the safest way pa rin is with doctor's recommendation. Gargling salt water. It is better if yung igagargle natin is warm water, then maglagay tayo ng salt, then igagargle natin kasi it helps siya na mabawasan yung discomfort natin sa throat, especially yung swollen sa loob, nababawasan din siya. Of course, lozenges. Lozenges has many different flavors. So, depende kung ano yung yung gustuhan mo doon, which is also a purchase over the counter, no need of doctor's prescription. Throat sprays, upon doctor's, ano pa rin tayo nito, prescription tayo. Sinusitis. It occurs if there is an infection or inflammation of the sinuses. This picture is divided into two. So the first, the half side of the picture shows a healthy sinus. So wala siyang mga blockage or inflammation sa loob. Yung second picture naman, nagpapakita siya na may inflamed na yung sinus lining natin. Ganyan. Then, aside sa meron siyang inflammation, nagkakaroon din siya ng mga mucus sa loob ng ating sinus lining. So, minsan nagkakamali tayo, tinatawag, oo, may sinus ako. May sinus ako, ganun. Gusto ko lang i-clarify ito na lahat tayo may mga sinus. So, the proper term to use is sinusitis. Ibig sabihin nun, there is an inflammation. Hindi natin pwede sabihin na may sinus ako. The correct term to use is sinusitis. So, what are the symptoms of sinusitis? First, nagkakaroon tayo ng nasal congestion because of inflammation and mucus secretion inside the nose. Nagkakaroon din tayo ng pain and pressure sa face. Of course, because of the pain and pressure, kaya nagkakaroon natin tayo ng headaches. Nagkakaroon ng runny nose, of course, loss of smell or taste. Huwag tayo magkakamali sa loss of smell or taste dito kasi it is also, makikita rin natin siya sa COVID na nagkakaroon na ng loss of smell or taste yung isang pasyente. To make sure na nawala talaga ang panlasa pang-amoy, we have to have a taste test and smell test. So how do we do it? Sa taste test, pwede tayong kumuha ng asin. We have to put it sa tongue ng patient. Then pag nalasahan pa niya na maalat, so ibig sabihin, hindi siya COVID agad-agad. Sa loss of smell naman, we have to get onions or garlic, ipasmell yun siya. Pag meron pa siyang na-smell na konti, so ibig sabihin, symptoms lang yun siya ng upper respiratory tract infection. Kasi pag COVID patient na talaga, based on our experience at natanong namin sa kanila, totally wala silang pang-amoy at panlasa. Of course, there is a thick mucus discharge and the postnasal drainage and cough. So kanina, di ba sabi ko, i-explain ko later what is the post-drainage and cough. So yung postnasal drip na tinatawag is yung ibang sipon mo pumupunta na dito sa throat mo. So because of that, nagkakaroon ng irritation kasi may infection na siya. And after that, to follow na, kaya nagkakaroon tayo ng ubo. Kaya minsan, pag nagkaroon ka ng sipon, ang kasunod niyan is ubo because of the postnasal drip. So what are the treatments for this? We have what we call the inhaling system or yung steam. This is very famous, especially sa mga taong sinisipon. What we're going to do is we have to boil a water. After that, ita-transfer natin siya sa bowl or any container, pero hindi dapat plastic kasi baka mag-melt. Then, we have to get a cloth or towel, cover it, at saka yung parang nagsusuog tayo. Pero yung iba naman, pas prefer nila pag nilalagyan ito ng Vaporub or Vicks, then i-inhale nila. Then other people naman prefer to put salt, then i-inhale nila. Then of course, we have this saline nasal rinse. So doctor's prescription pa rin to. Painkillers such as ibuprofen or paracetamol, so which is also can be purchased over the counter. And nasal decongestion, like for example ito, which can help din siya para sa airway natin na makahinga yung patient. Next is laryngitis or what we call the inflammation of the larynx. Also, what we call the voice box. So in this picture, makikita natin, ito yung normal na vocal cord ng isang tao. Pag nagkaroon na siya ng infection or inflammation sa loob, nagiging ganito na siya. So, very red. Pareho lang din siya ng parang may sore throat ka. Pero ito yung vocal cord na natin yung affected. So what are the symptoms of laryngitis? Of course, we have what we call the sore throat, hoarseness of voice. Or minsan, totally nawawala na talaga yung voice ng pasyente. And then, nagkakaroon na yun ng swelling ng glands. So, pag kinapa natin ng ganito dito, because we have lymph nodes here, pag kinapa natin dito at inflamed yung lymph nodes or very palpable siya, it means to say, your lymph nodes is fighting dun sa pumasok na infection sa loob ng katawan mo. So, we have to be thankful na kahit papano, it helps siya na hindi ka magkakasakit. But then sometimes, matatalino din tong mga invaders na to. What they did is, nag-change sila ng shape and structure. That's why nagkakaroon na ng disguise. Hindi na sila na-recognize ng ating immune system. So pag hindi na sila na-recognize, ang tendency nun is papasok na sila sa katawan. That's why nagkakaroon na tayo ng sakit. And then, we need to clear our throat with warm drink or soup, then water. What are the treatment options for this? Of course, we need to rest our vocal cords. We need not to talk for this. If may kailangan tayo, pwede tayong mag-sign language sa kanila or we can write it down para at least hindi talaga magagamit yung voice natin para totally well-rested siya. Then, using humidifiers at home can also help. Gargling salt water, warm water, ito na nilagyan ng salt. Then, it helps if we will drink more fluids and avoid smoking and alcohol. Fifth is rhinitis. This is very common, especially ngayon December. If may mga tao kasi na may allergic rhinitis, so very susceptible sila, lalo-lalo na cold weather and sa dust. This is the inflammation of the nasal passages. So makikita natin dito na ito yung normal na nasal passages. Once na-inflame yung nasal passages natin, ganito na siya, namamaga, and then of course, may presence ng mga mucus secretions. What are the symptoms? Of course, we have the runny nose, sneezing, itchy and watery eyes. Ang itchy and watery eyes and sneezing, this is really very, very common sa mga taong may allergic rhinitis. Of course, nasal congestion and post-nasal drip. So, if you notice, yung 5 na example ng mga upper respiratory tract infection, mananotice nyo, halos pare-pareho sila ng symptoms because isa lang yung isa lang yung body's respiratory system kasi. So, doon na siya nag-o-occur, kaya pare-pareho sila ng symptoms. So, what are the treatment for this? We have antihistamines. So, yung antihistamine, meron tayong dalawang klase, yung drowsy at saka yung non-drowsy. Kung kinakailangan mo talaga mag-report sa work and you have allergic rhinitis, you can take 2 tablets of antihistamine, which is loratadine. Pag loratadine, hindi ka aantukin. Example ng mga gamot na nakakaantok is the Benadryl, which we have in the clinic. That's why we're giving 10 to 15 minutes rest. And then yung Verlix also, nakakaantok din siya. And of course, avoidance to allergen. How to avoid? We have to take care of ourselves as well. Of course, precautionary measure na rin. Kung naglilinis ka, for example, ng bahay at may exposure ka sa dust, of course, you need to cover your mouth and nose with mask. If wala namang mask, pwede naman handkerchief or any cloth. I will just share to you my experience about dun sa allergen. Ako kasi before, I have also allergic rhinitis. Since nag-nursing kasi ako, we have this what we call a community service. So, hindi pwede na all the time na lang mag-absent ako, excuse ako, dahil nagkakaloon ako ng allergic rhinitis. So, what I did to myself is I did what we call desensitization. Desensitization means you are exposing yourself to your allergen. So, yun yung ginawa ko until eventually later na-adapt na siya ng katawan ko. So, nawala na rin yung allergies ko. Since nag-nursing ako, siguro mga na siya ngayon, 10 years na nawala na akong allergic rhinitis because in-expose ko yung sarili ko, which helped me a lot kasi nawala yung allergic rhinitis ko. Another treatment option is the nasal spray. Of course, nasal spray is upon doctor's prescription pa rin. So we need to check pa rin doctor for this. And of course, the very famous, the steam inhalation, which helps also para dun sa airway ng isang patient. So what are the complications of the upper respiratory tract infections? Itong sasabihin ko na mga complications ng upper respiratory tract infection is, ito na yung mga worst na talaga ng mga scenario. So of course, sinusitis, bronchitis, and pneumonia. Itong bronchitis and pneumonia, this is already sa lower respiratory tract. Of course, first kasi papasok siya sa upper respiratory tract. Pag napabayaan siya at nag-worst yung condition ng isang patient, magiging ano na siya, papasok na siya into lower respiratory tract infection, which is ma-experience na nila yung bronchitis and pneumonia kasi sa lungs na ito. Then formation of abscess in the tonsils, yung kagaya kanya pinakita ko na picture na nagkaroon siya ng nana. So yun tinatawag natin abscess or pus. Then of course, rheumatic fever. Meningitis is the inflammation of the meninges. Sa brain naman ito. And of course, asthma or COPD or chronic obstructive pulmonary disease. So patient nito nahihirapan ng huminga. Usually, pag COPD patient, bihira lang yung nasa room lang. Usually, nilalagay ang patient nito sa ICU for monitoring. Pericarditis and myocarditis also, and then muscular pain. So what are its prevention? Paano natin mape-prevent yung upper respiratory tract infection? Of course, the most common is hand washing. Very frequent hand washing ang kailangan natin to prevent the transmission of viruses and bacteria. Of course, reducing contact with people. Especially ngayon, there is pandemic, so iniiwasan natin yung mga gathering or yung mga crowd kasi because of those, hindi kasi natin alam kung sino sa kanila doon yung infected already of the virus. So, precautionary measure lang para sa sarili natin and sa family. Proper cleaning of common objects. So what are these common objects? The doorknob, which is frequently hinahawakan talaga natin. Aside from that, yung tables, chairs, for example. Sa office naman, yung mouse, yung keyboard, the tables, the chairs, or anything na pwede nating i-pass on sa mga office mates natin. Of course, when you sneeze or cough, you need to cover your mouth. If you're using tissue after itapon mo siya, then wash your hands with soap and water. Or yung sabi ko sa inyo kanina, yung damit, ganituhin siya pag sneeze ka or nag-cough. Then of course, the vaccination flu, which is once a year lang naman, so pwede tayong kumuha ng flu vaccine. Usually, pag sa mga adults naman, pag kumuha sila ng flu vaccine, usually it is accompanied by pneumo vaccine. Pneumo vaccine will last for 5 years naman, and flu vaccine will last for 1 year. That's why yearly tayo nagkakaroon ng flu vaccination. So, because of the upper respiratory tract infection ng mga symptoms, it is also, sabihin natin, associated din siya sa coronavirus because halos they are just the same. Could it be coronavirus? So magtataka ka minsan kasi meron akong ubo, meron akong ganitong mga symptoms. Parang ask natin yung self natin, am I a coronavirus positive already or positive na ba ako? So if you have high temperature, a new continuous cough or loss of change to your sense of smell or taste, it could be coronavirus. So ang palatandaan talaga namin dito usually is yung loss of smell or taste. Kasi pag nagkaroon na talaga ang patient ng ganito, possible talaga positive siya sa COVID-19. So, COVID-19 can move, as what I've said kanina, manggagaling siya sa upper respiratory tract infection. Pag napabayaan siya, it will go to lower respiratory tract infection. So, coronavirus background. So coronavirus are large number of viruses that can cause illnesses. So what are these? These are the SARS or the Severe Acute Respiratory Syndrome. Then Middle East Respiratory Syndrome or MERS and the COVID-19. So this is the upper respiratory infection of a COVID-infected person. So if you notice, pareho lang din siya ng upper respiratory tract infection natin na viral or bacterial infection lang. So viruses enters the upper respiratory tract. Pag pumasok kasi yung mga viruses sa upper respiratory tract natin, yung port of entry nila is the nose natin usually. So, or mouth then. So, pag pumasok sila doon, we have what we call this immunologic barriers. So, ano to yung mga immunologic barriers? These are the hair inside our nose. So, pag pumasok doon, natatrap siya for to invade the microorganism. Another one naman is yung wet mucus inside the nasal cavity natin. It can engulf or cover the viruses and bacteria that enters our body. But then, sinabi ko rin kanina, because matalino din itong mga viruses na to, so nag-change sila ng appearance and shape. That's why hindi sila nare-recognize ng ating immune system. That's why it can cause diseases. So virus begins to replicate by invading the healthy cells. So the symptoms, again, the sore throat, the dry cough, shortness of breath or difficulty of breathing, nagkakaroon ng fever, headache, and fatigue. So what are the treatment? Drink plenty of fluids, more on rest, taking the over-the-counter medication to lower the fever. So para yun yung ating management para sa ganitong klaseng sakit. But then, kasi if naging COVID positive na si patient, usually kasi nagko-coordinate sila sa barangay. So the barangay will be the one to give them instructions what to do. Or minsan, sinasabihan din namin sila na magpapacheck din sila sa doctor. So proper medication will be given to them. Then of course, nagkakaroon tayo ng mga treatment nito is also for the body aches kasi sumasakit din yung katawan nila and decongestants for those sa mga affected ng colds. Of course, the duration of this is patient with upper respiratory infections typically feel sick for 1 week to 2 weeks. That's why yung ating quarantine is 14 days. Coronavirus, it is an acute respiratory illness that can be severe and is caused by newly identified coronavirus officially named as a SARS-CoV-2. So ito na yung ito na yung nangyari sa pandemic natin ngayon because of this coronavirus. That's why many people are already affected of this and of course marami na ring namatay with this virus. So what are the symptoms? If you notice, yung mga symptoms natin dito is also makikita nyo rin sa ating daily health assessment. What are these? Number 1 na dito yung fever. Nagkakaroon tayo ng cough, shortness of breath or difficulty of breathing. Nagkakaroon tayo ng chills or repeated shaking with chills. Nagkakaroon tayo ng fatigue, muscle pain, of course headache, sore throat, loss of smell or taste. So totally wala talaga itong panlasa at pang-amoy. Unlike sa upper respiratory tract infection na meron pa kahit konti. Then congestion of a runny nose. Of course, meron ding nausea and vomiting and of course the diarrhea. Here we will show you the incubation period ng COVID. That's why sinasabi nito na 14 days talaga yung quarantine ng isang patient because symptoms usually appear 2 to 14 days after people are infected. Most commonly within 4 to 5 days. So ito yung incubation timeline niya. Day 0, Ashley is exposed to COVID-19. Nagkaroon na siya ng exposure. Then, hindi agad-agad magkakaroon siya ng signs and symptoms. Day 4, Ashley learned she was exposed. Napagsabihan siya na meron siyang exposure, so ang ginawa niya is nag-self-isolate siya. Day 5, Ashley gets tested for COVID-19 at ang result nito is negative. Day 8, Ashley thinks she doesn't have COVID-19. So what she did, because she tested already negative, so ang ginawa niya, she went to a small family gathering and Ashley doesn't know that she does have COVID-19 and is contagious already and without having symptoms. So asymptomatic siya. She now has exposed to 11 people. Ito yung mahirap kasi ma-exposure na tayo, infected na tayo, since asymptomatic, so akala natin wala lang. That's why, ang ginagawa din natin minsan is, pumupunta tayo sa any gathering, or nag-visit tayo ng family members natin, which is, hindi naman dapat kasi in our work, very susceptible tayo kasi everyday meron tayong exposure. Especially those people na ang means of transportation is the public utility vehicle. So, hindi rin nila alam kung sino doon yung mga may mga exposure or naging positive din. Then, day 10, Ashley develops symptoms and she gets tested again and test positive for COVID-19. So, until umabot na siya ng 14 days. So, kaya ito yung tinatawag for us to understand what is the incubation timeline of COVID. Kaya kailangan natin talaga ng 14 days quarantine. So, what are the risks of serious diseases and death in people with COVID-19? Why it increases? Of course, the age. People who are 21 below, hindi na nga sila pinapalabas dapat ng government. But then some are still going out. So, very susceptible dito yung mga bata and yung mga senior citizen na mga tao kasi ang immune system nila, as what I've said kanina, is very low. People who smoke, they are also very risk din po sila sa COVID. People with other serious medical conditions like, for example, the cancer, heart, lung, kidney, or liver diseases, with sickle cell disease, yung may mga diabetes, obesity, and immunocompromising disorder, yung sinabi ko na kanina na may mga HIV or AIDS patient, yung mga also for immunocompromised patient are also may mga nag-undergo ng transplant, and then yung mga inherited na diseases like congenital type of disease. So, COVID-19 IPC priority. So, what is this IPC? It is infection, prevention, and control. First, if ang patient is already infected by COVID, rapid identification of suspect cases. That's why nagkakaroon tayo ng contact tracing. So, ang ginagawa sa kanila is nagkakaroon ng screening or triage or at initial healthcare facility encounter and rapid implementation of source control. Then, nagkakaroon tayo ng limiting of entry to healthcare workers and visitors with suspected or confirmed cases. So, after this, kaya ang ginagawa natin is pinapa-report natin sa barangay yung mga taong exposed and with symptoms of COVID para mag-guide sila properly what to do. Second is immediate isolation and referral for testing. So, automatic ina-isolate sila. If merong isolation facility, nilalagay sila doon, or minsan ang ginagawa na lang din is sa bahay na lang sila ina-isolate. Then after that, sineschedule na sila for swab test. Third is for safe clinical management, immediate identification of inpatient and healthcare workers with suspected COVID-19. So, doon na natin malalaman kung sino, after lumabas na yung result, doon na natin malalaman sino yung positive sa negative. So, kailangan natin silang i-separate or i-isolate. So, adherence to IPC or the Infection Prevention and Control, appropriate use of personal protective equipment or the PPE is really very important or a must. So, always remember that the decisions we make impact everyone. We have to protect ourselves and protect everyone. Do you have any questions for the topic that we have today?
All right. Thank you so
Okay,
much
thank
for that
you.
very informative explanation or discussion with Nurse Claude. I think they don't have any questions. It's because it's clear and you were able to discuss what are the signs and symptoms and how to prevent it. So if you don't have any questions, guys, so you can contact our nurses through 420, or you can send us a Skype message to APOSI Clinic team. So thank you so much for your time. Stay tuned to our next wellness. So the topic would be immediate care for emergency cases. So thank you for your time also, Nurse Lord, and have a great day,
You're
everyone.
welcome. Thank
Bye.
you.